My best friend, who is now in a healthcare-related job, meets me for lunch. He seems upset. He pulls out a report received from one of the genetic home testing companies and said, "This thing says that I am predisposed to type 2 diabetes. What should I do? I don't eat sugary foods." In layman's terms, I will try to explain to my friend what this means. I want to start by giving you a definition of diabetes according to my textbook. Diabetes refers to a group of conditions characterized by hyperglycemia, resulting from defects in insulin production, insulin action, or both. Diabetes is a complex condition. Several factors must come together for you to develop type 2 diabetes. For example, obesity and sedentary lifestyle play an essential role. Genetics can also influence whether you will develop this disease. There is a good chance you are not the first person with diabetes in your family. You are very likely to develop the condition if one of your parents or siblings has it. If one of your parents is diabetic, you will have 40% of chance to be a diabetic in the future. If both parents are diabetic, your chance will increase to 70%. If one twin has type 2 diabetes, the chance that the other twins will have it is 80%. What is inherited is the risk of presenting it, but in this case, there is also a polygenetic inheritance and environmental factors that influence the development of the pathology. Several gene mutations have been linked to the development of type 2 diabetes. These gene mutations can interact with the environment and with each other to increase your risk. I've been doing some research and reading articles on genetic and diabetes. Scientists have linked various gene mutations to an increased risk of diabetes. Not everyone who is a carrier of a mutation will have diabetes. However, many people with diabetes have one or more of these mutations. A research study found that intake of fruits relieves the association between the genetic predisposition of type 2 diabetes and the risk of diabetes. In another research, the researchers found that environmental factors, in concert with one or more unknown genetic predisposing factors, give rise to insulin resistance as a primary pathophysiologic component. It can be difficult to separate genetic risk from environmental risk. Members of your family often influence the latter. For example, parents with healthy eating habits can pass them on to the next generation. Here we can see some risk factors of type 2 diabetes. Some of them we can control it, and some of them we cannot. For example, we have ethnicity, a family history of diabetes, or being 45 years old or older. Well, I can recommend that you tell your doctor about your family history with type 2 diabetes. They can decide if genetic testing is right for you. It can also help you reduce your risk with lifestyle changes. Your doctor will also want to check your glucose levels. Testing can help detect blood sugar abnormalities or identify warning signs of type 2 diabetes. Early diagnosis and treatment can have a positive impact on your outlook. It is necessary to point out that environmental factors play a primary role, even in groups with a significant genetic predisposition. Here we have some reference if you would like to know more about this topic.